All I can ask is the viewers to share this. Tell your friends, I know this is long. This is a 5-hour-long panel, and we didn't even scratch the surface of what we need to discuss. This shouldn't have been necessary. As our information grew, as we became better and better educated, less ignorant about the coronavirus, COVID, the COVID vaccines, this should have been made public every step along the way, but it wasn't. So again, I'm just asking the viewing public to have an open mind, respect these individuals who have paid a significant price, professionally, reputationally.
How many of you in this room, recognizing there are doctors, there are PhDs, there are attorneys, media experts, other scientists, public citizens, how many of you personally have witnessed censorship, intimidation, or professional reprisal and damage as a result of your advocacy for patients? I want this to be recorded. That is 80% of this room have experienced something negative in their life in trying to promote and help compassionately something positive for patients suffering with a potentially fatal illness.
I'd like to start really quick with a story. So a high-risk individual approaches me, 50 years old, obese, type 1 diabetic, calls me, I have COVID. This was about a year ago. What do I do? Help. Help, I'm going to the ER, my oxygen's 86. I have excruciating pain in my lungs. So I said, you're going to the pharmacy, don't go to the ER. I called in some early treatment medications of the drugs which shall not be named. Said individual calls me a couple hours later and says, you know that excruciating 9 out of 10 lung pain, it's now 2 out of 10, 6 hours later. Well, I know the mechanisms of the medication I prescribed. A few hours later, and the next morning, he calls me, he says, you know that oxygen saturation of 86, it's now 98%. I said, isn't that fantastic? Early treatment works. That individual's my brother. I am my brother's keeper.
This warning says, FDA cautions against the use of hydroxychloroquine in outpatients outside of the hospital setting. But then, in the justification, it says, we base this on information to treat hospitalized patients. Hospital disease, as we'll hear, and as we know from 2 years of dealing with COVID, is a completely different illness treated with different drugs, different medications in the hospital. Outpatient disease is flu-like. Hospital disease is a florid pneumonia. And so the fact that the FDA would base recommendations and warnings on hospital disease, which is a totally different disease than outpatient disease, is a fraud. This website is still there today and constitutes an outright fraud.
Again, I'll point out there's so much we don't know. I would have liked to have seen a much larger dose of modesty coming out of our federal health officials and the legacy media and big tech when it came to, we would be so much better off if there was robust debate and discussion.
I have to say, I'm going to call it out, and I'm known for this. I call it like I see it. I'm calling attention to the corruption. If you look at these innumerable failed policies, there's only one way to understand them. They are literally written by pharmaceutical companies. Almost every single policy serves the interest of a pharmaceutical company. However, if you look outside the United States and look around the world, there have been numerous successes. As one of the world experts on ivermectin, let me just talk about some programs which used ivermectin. My colleagues here, as Dr. Risch just pointed out, there are a number of compounds that we've identified that are effective in early treatment. Almost all of them are repurposed or generic. But let me just say a few words about ivermectin and what it's doing around the world. Not in the United States. In the United States, it's a horse dewormer, it's horse paste, and only the illiterate, ignorant, and or unvaccinated use it. That medication has been shown to literally solve the pandemic in numerous regions around the world.
And as time went on, they were told, in no uncertain terms, if you use these drugs you probably will be fired. And nobody had to tell them. They're smart people. You don't have to draw a map. Why is an ophthalmologist treating? Because patients were languishing at home. And I've treated over 1,600 patients because patients were languishing at home with no treatment for inflammation, with no treatment for respiratory distress, with no treatment for blood clotting. It's absolutely absurd, and I wasn't going to let it happen. And I think, as you see in this room, all of us feel the same.
Are African Americans, are they denied early treatment in the community?
Well, yes, they are. My dad just died. Right? He died Friday. Couldn't get a test, couldn't get monoclonal antibodies. We treated him at home. Unfortunately, we had an oxygen machine that didn't work. So his blood saturation went down to the point where he was incoherent. We called EMS. They said, your problem is your oxygen machine doesn't work. They put oxygen on him. He went to 98% saturation. We moved him to the hospital. He recovered all his cognitive functions. He was doing quite well, but he was no longer getting medications that reduce his inflammation. He was no longer getting medications that blocked the histamine response. He was no longer getting the medications that he needed, and he was no longer getting lung steroids, and he just declined and declined and declined until he passed away on Friday, and I say he passed away from lack of appropriate care.
So in the last 6 months, I've really evolved into a early treatment advocate. I've used a combination of medications, and up until recently, I was using monoclonal antibodies, and sadly, we can't get those anymore. I just hear so many stories. At first, it was, my PCP won't see me, so they came to see me, an ENT. I became the PCP. Now it's people are terrified to go to the hospital, so I've become the emergency room. I'm giving high-dose IV steroids. I'm giving 25 grams of IV vitamin C, but I am keeping people out of the hospital, and I've kept over 2,000 people out of the hospital. And if you look at current statistics, 20 of those people should be dead, and they're not. So, and the turning point for me when I really got angry was a patient that his wife reached out to me. He's trapped in the ICU, a father of 6, sheriff's deputy, refused to give anything. But these hospitals give them low-dose steroids. They give them 6 milligrams of dexamethasone, 3 times a day. A lot of these hospitals won't even give breathing treatments. It's ridiculous. They won't give them the vitamins. And so basically she called me in desperation, and I testified. She sued the hospital to try to get her husband the medications he needed. I testified. We won. The hospital refused to grant me privileges, even though I have a spotless record. And I was furious. That's when it all changed for me, and I became thrust into the public because of Methodist Hospital. But it's just, I've seen a lot, and I'm angry, and I'm exhausted. I have one hospital I can send patients to that I feel safe to.
Some of those heart-wrenching stories I'm hearing where a loved one's in the hospital, and the family's begging the hospital to do more, trying to save the person's life. And they're just being told, now your loved one, there's not much hope. Get ready for the worst, and they just won't do anything.
So the question is, why? Why have cheap, safe, and effective drugs been ignored for the treatment of COVID-19, which could have saved maybe 500,000 lives? And I think Dr. Corey has told us exactly why.
I want to talk about medical ethics because I'm concerned that many of our pandemic policies have ignored foundational principles of medical ethics. We effectively abandoned patients that were suffering from other conditions and had other medical needs. The disastrous fruits of this myopia include an unprecedented 40% increase in all-cause mortality among working-age adults 18 to 64 over the last year, most of which, 2/3 to 3/4, depending on the state, was not related to COVID. Actuaries tell us that a 10% rise in all-cause mortality is a once-in-200-year disaster. This was a 40% rise.
In my opinion, we should not have politicized the public health response to SARS-CoV-2 and COVID-19. This is a bipartisan issue, And the physicians represented here are truly a bipartisan group. I'm not, although I've been characterized as a right-wing Proud Boy, I've previously supported both President Obama and President Biden's campaigns. But the course of events have forced me to rethink a lot of my positions, and I think that's the case with many of my peers. If I may quote, in May of 1995, Nelson Mandela said, "There can be no keener revelation of a society's soul than the way in which it treats its children." In my opinion, our public policies in managing this have had a particularly strong adverse effect on our children, and vaccine mandates for our children are completely unjustified at this point.
So my friend called me a week ago. He said, watch this new movie. It's called Don't Look Up. And I told him, listen, I don't need to look at this movie. I've been in this movie for the last 2 years.
We have better treatments, and we should be investing in research to continue to improve our treatments and strategies to make sure that we have treatments available everywhere where someone vulnerable especially gets sick. If you put these strategies together, our society can continue to function in a much more healthy way than we have functioned these past 2 years, while at the same time working to protect older people. The strategies we followed, basically by ignoring the possibility of early treatment, by not focusing our efforts on the protection of vulnerable populations, and worst of all, these restrictions on human behavior, on human connection, have wreaked enormous damage. And it's far past time that we stop those policies and instead followed an alternate plan.
So Dr. Bhattacharya was joined by colleagues from Harvard and from Oxford and put together the Great Barrington Declaration. I'm pretty sure they published that in, I think it was October 2020. We've since seen emails between Dr. Collins and Dr. Fauci, head of NIH and NIAID, basically with a concerted effort to destroy, reputationally destroy Dr. Bhattacharya and his co-authors. Now, I'll ask the listening audience, does that sound like a crazy individual? Sounds to me like a highly qualified, very reasonable person, as we've assembled in this room.
One worry that public health officials have mentioned is, well, if we acknowledge that natural immunity is a reality, which of course it is, and it's epidemiology and immunology 101, they're worried that people would go out and deliberately get COVID rather than getting the vaccine. But of course, the issue around acknowledging natural immunity is, what about the people who already have had COVID? That's what we're talking about here, right? And we can give people advice on, avoiding infection and so forth. But ignoring all the folks that have already recovered from COVID is not a good public health policy. Acknowledging natural immunity would lead to the next very basic question: how many people have it? And the fact that 2 years into the pandemic, we still do not know exactly how many Americans have had COVID it's an astonishing failure of public health to do basic epidemiological research. The two most basic facts that every medical student learns first about every new illness that they learn about are incidence and prevalence. How many new cases and how many total cases over a given period of time, right? One very important fact about natural immunity is that there has not been a single reported case of someone getting reinfected and subsequently transmitting the virus to others, which we know is not the case for vaccines. Vaccines don't offer, against COVID, that kind of sterilizing immunity. So we FOIA'd the CDC and said, please show us any evidence of someone with natural immunity getting reinfected and transmitting the virus to others. They couldn't come up with any data. We actually put that in our lawsuit. The university's experts could not come up with a single counterexample. It's a very dangerous thing to say, right? Because almost nothing in medicine and science is 100%. You can always find outliers. But natural immunity, people with natural immunity are the safest people to be around. You're not going to get COVID from somebody who's already had COVID.
So we are seeing actually the vaccinated carry a high volume of virus because they don't have this secretory IgA. So this false construct from our federal agencies that this is a pandemic and the unvaccinated are spreading is a pathophysiologic lie. The vaccinated are carrying high volumes in their nose, their tears, their mouth of virus because the vaccine does not neutralize in that location of the body where the virus comes in. So this is very important. This is why mandates are absolutely now moot, irrelevant, and out the window and need to go away worldwide like most of the world has done already. This is the funny uncle. This is not SARS-CoV-2, COVID-19. This is COVID-22 meh.
Yeah. 0 randomized controlled trials that show masks stop the spread of respiratory disease, and that's including N95. And for everyone, N stands for non-oil resistant, 95 stands for 95% airborne particles of which all viruses fit through. So I usually tell people that, you know, wearing an N95 also has not been shown in randomized controlled trials to be effective. But more importantly, the capsule on these viruses are an oil capsule, and I tell people it's like peeing in a pool. It goes right through. It doesn't stick to water molecules. It's an oil capsule virus. At the end of the day, the data is what it is. There's 0, repeat, 0 randomized controlled trials at all showing that masks stop the spread of upper respiratory disease.
So you've treated through telemedicine,
yes,
150,000 COVID patients.
Yes, sir.
With his team. Yeah.
With your team?
Yes, with the team. We have a team of volunteer-free doctors that donate their time to help treat these patients that come to us. They go to myfreedoctor.com, and they answer our questionnaires. We deliver the early treatment protocols to them as early as we can, and we have a 99.99% survival rate. So I believe myfreedoctor.com, the volunteer-free doctor team, we have settled the science on this. Early treatment works, period.
But the key answer is to find a doctor who is going to treat you. And then that doctor has got to be cognizant that a lot of his scripts will not be prescribed. Like I have patients in Virginia, I treat them. I have to figure out where I can get the relevant drugs. And that often means independent pharmacists.
But these are crimes. You know what's going on in this country right now? Is that the CDC has been captured by the pharmaceutical industry. They sent out a memo in August of 2021. They sent out a similar memo back in the spring of 2020, telling the nation's physicians and pharmacists not to use generic medicines. We are now in a state in this country where Senator Johnson asked the question, how can we get the average U.S. citizen to treat or get treated? We have pharmacists across the land who are refusing to fill these because they've been manipulated and brainwashed into thinking that the FDA hasn't approved the use, as if that matters. Off-label prescriptions and prescribing has been going on for decades. It's encouraged when there are no effective treatments. Yet I have to, when I try to treat my patients, and Dr. Marble can attest to this, we have pharmacists who refuse to fill some of the safest and low-cost medicines known in the history of medicine.
All the different drugs that there have been some research on. And what was interesting about this chart is Dr. Corey circled the ones that are recommended by our health agencies. They all range from $700 up to $3,200. All the ones that are not recommended are the ones that are, a couple bucks. Go figure.
I've lost a third of my business because insurance contracts have pulled away from me for unprofessional conduct for using these dangerous drugs, ivermectin, for which my patients have had no adverse reactions. I've treated 500,000 patients or diagnosed 500,000 patients diagnostically in my career. I have not had one single complaint against me. I have 4 complaints against licenses in 4 different states for saving lives. So the adverse reaction from these drugs is being attacked for being a good doctor. That's the bad adverse reaction, and I know many of my colleagues on this panel as well.
And I can tell you 201, the patients that I've lost, it's because we've gotten a late start on early treatment. I recently published a paper with Fazio and colleagues from Italy, We have shown the golden window to treat COVID-19 is the first 72 hours. And the patients that I have lost, and they've been very few, but if people listen to this out here, they will recognize that it's a late start at treatment that is, in a sense, the failure of early treatment. If we start early, we have uniform successes. I've reviewed hundreds and hundreds of reports of hospitalized patients and of those who've died of COVID-19. And in those reports, the clear observation is the determinants of hospitalization and death are the lack of early treatment.
I am completely agnostic when it comes to whatever drug will end this pandemic, vaccine, whatever. I don't care. I want this pandemic over. I want people to live.
We also had the wrong bodies leading the vaccine program. Remember, the FDA is supposed to be the safety watchdog. The National Institutes of Health is the government research body, and the CDC is the outbreak investigation body. Right now, the CDC and the FDA are the named sponsors of a vaccine program. If American can learn anything, we should never have the FDA and CDC be a sponsor of a public program in administering a product. It has been a giant and colossal mistake. We should have had a separate body, a government body, be the sponsor of the vaccine program. The vaccine manufacturers can supply the products, and then we needed the separate Data Safety Monitoring Board, Clinical Event Committee, and Human Ethics Committee there in oversight. And if this would have happened based on the emergence of unexplained deaths, I am testifying today that the program would have been shut down in February because of excess mortality.
They will attack you, they will threaten you, they will put you in a state of fear and say, you can only do what we say, but don't save a life. And by the way, the vaccines are expired because Omicron is here. And now they still want to mandate them. So they threaten us and threaten us and threaten us, and we're hunted for caring and being compassionate and empathetic and wanting to help humanity.
Is it logical to think that if you've been harmed by the first dose, then you shouldn't get a second dose? And if you get the second dose and you're harmed, would the booster potentially do more harm? And if you were on the 7th booster, would that potentially cause more harm down the road?
Of course. You don't have to be a physician to know the answer to that question. A 4-year-old knows the answer to that question.
And I just want to partner off of what Dr. McCullough said. I don't think people realize that all these people who had COVID were excluded from the trials, all of them. So we're going to take our 5 to 11-year-olds, that there's 28 million. That means 14, it was about half and half. It's probably more, 60% have had COVID already. So let's say 12 million have not had COVID. So if those 12 million had the vaccine and it was a perfect vaccine, it's 0.1 per 100,000, we might sell 12 children. What's going to happen to the 16 million children who've already had the virus, who already have immunity, and we're going to subject them to something that wasn't even tested in that group? It's literally absurd. And that's the thing I would say, Senator, is that we're not here about civil liberties and mandates. We're here to save lives. And this group of people should be excluded, absolutely. There's an Achilles heel to the program of natural immunity. Natural immunity denial should not be happening. It should be a major focus of what we're trying to do here, because you're going to harm, I don't know how many children by force vaccinating 16 million children. It's absurd.
I'm listening to my colleagues call out all of the inanities, the insanities, the absurdities, okay, these departures of our policies from what we know are to be scientific truths. It's things like denial of natural immunity. We have to understand why. To sit here and point fingers and they're doing this wrong and that wrong, why are they doing this? There could be multiple reasons. The simplest and most easily understandable and provable is every vaccine, these novel, patented, high-cost drugs is profits. They are putting profits ahead of patients. We can call attention to all of these policies. They are non-scientific. They're failing at having scientific support, yet they're being carried out and they're being distributed across the country. And doctors and states and health departments are willingly accepting these without question, without critical thinking. And that's what I want us to be clear that we're calling attention to today. This is corruption. Plain and simple, it's corruption.
Why are they vaccinating our children? Because once it's on the vaccine, once it's on the childhood schedule, they are no longer liable for injury. So they're going to get off that EUA, put it right on the childhood vaccine schedule, and then have no liability going forward.
So I'm going to have to read you a quick little news story out of Vietnam. Just got this today. A 9th grader in the northern province of Phu Tho died Tuesday after getting her second Pfizer vaccine dose, the local medical center said Thursday. The girl had gotten her first Pfizer dose on December 3rd, 2021, after which she experienced dizziness and had difficulty breathing. She was taken to a medical center for treatment and later recovered. She had her second dose last Monday. Her mother told healthcare workers about the girl's side effects following her first shot, but they asked her to get the second shot anyway. Again, this is a 9th grader. Doesn't have much risk from COVID. Has a reaction to the first dose, but let's give her the second dose anyway. 20 minutes following the second shot, the girl experienced tightness in her chest, dizziness, difficulty in breathing, and seizures. She received emergency treatment on the spot before being transferred to a district medical center. On arrival, she began to vomit blood, fell into a coma, and her heart stopped. Her family received news that she died Tuesday morning. Now, I guess this isn't evidence that a death might be related to the vaccine, but it certainly would concern me more than it's concerned Dr. Fauci, Dr. Lewinsky, Dr. Collins, Dr. Woodcock, Dr. Marks, I know one of your favorites, Brianne. This is reality. This is a reality that's being ignored by our federal health officials, by the legacy media.
But every patient is a new textbook. Every patient is a unique human being that has unique factors that only we and the patient really understand with sufficient depth to make difficult medical judgments. And this is the first time in my career, I think the other clinical physicians in the room would agree, where I've worried about, is somebody going to be looking over my shoulder asking me why I've prescribed fluvoxamine for this indication rather than that indication? I prescribe it for depression, no problem. Are you giving this to treat COVID? Why should it matter to you? So it induced...
So you're saying this is the first time in your...
Yeah, the last 2 years.
Is that true?
The last 2 years. Now, there are things that hospital administrators do that have annoyed physicians for years, but the kind of hamstringing of physicians in terms of doing what we believe to be the right and best and good for this vulnerable patient in front of me right now, that is my only responsibility as a physician, this patient who has placed their trust in me as their physician to do what is best for them and not be acting as the agent of a social program or a state program or any other interest that could compromise.
So I can tell you what happened to me. So I was using our protocol to treat critically ill patients in the ICU with a whole host of repurposed drugs. This is a memo. This is a memo sent to the entire healthcare system, but they targeted me personally. And what did this memo say? This said, I can use remdesivir, and then I will quote. There was an added section, do not endorse section, which includes medications that may cause harm and efficacy is not supported in peer-reviewed published RCTs. These medications will not be verified or dispensed for the prevention or treatment of COVID. This list includes ivermectin, bicalutamide, etoposide, fluvoxamine, dutasteride, and finasteride. And then just to stick it to me, they added ascorbic acid.
Otherwise known as...
The system was effectively preventing me treating my patients according to my best clinical judgment. And then how did this progress? I objected. So the first week I was in the ICU, I didn't know what to do. What was I to do? My hands were tied. As a clinician, for the first time in my entire career, I could not be a doctor. I could not treat patients the way I had to be to treat patients. I had 7 COVID patients. including a 31-year-old woman. I was not allowed to treat these people. I had to stand by idly. I had to stand by idly watching these people die. I then tried to sue the system, and you know what they did? They did something called peer sham review. It is a disgusting and evil concept. They then accused me of 7 most outrageous crimes that I had committed, and that I was such a severe threat to the safety of patients, they immediately suspended my hospital privileges because I posed such an outright threat to these patients, ignoring the fact that under my care, the mortality was 50% those of my colleagues. I then went on through the sham peer review. I went to a kangaroo court where they continued this, and the end result was I lost my hospital privilege and was reported to the National Practitioner Data Bank. So here I was standing up for patients' rights, and this hospital, this evil hospital, ended my medical career. So that's what they do. It's an outright outrage. It's evil to the core.
You can use safe, effective, off-label drugs for other conditions outside COVID.
Absolutely. Yeah. If this was pneumococcal pneumonia, this wouldn't be an issue. This is specifically for COVID.
I'm still a nurse, but I was fired from Houston Methodist. I'm the one you might have seen all over the news. We were the first one mandated with the COVID shot. So I blew it up on the national media. We have a huge state and federal lawsuit because we didn't want to be guinea pigs. We saw for ourselves in the hospital people coming in with adverse reactions after getting the Pfizer shot. And the crazy thing is let me tell you a couple things about Methodist Hospital down in Houston, Texas. When they first started with COVID, I did that COVID unit on and off the whole time till they fired me in June, right? They started the first 2 months with hydroxychloroquine. They actually used it in the hospital. Then they cut it back real quick, switched it to remdesivir and all these other expensive drugs. And we're like, why? And we would ask these doctors, no one could give us a reason. They just said, well, the hospital policy changed. But they didn't know why. And you know, most of those doctors in that hospital would not even go in those COVID rooms. There was maybe 2 that would. They would stand outside, make us dress up head to toe, and go in with an iPad. So the only form of communication those doctors would have at Houston Methodist with the COVID patients was through an iPad. So literally we'd go in there, they'd be talking to them, never assess the lungs, never look at them, nothing, go to discharge them. I would come back out and be like, no, have you listened to them? They can't breathe. Like the wheezing's horrible. They had no clue.
80% of us are misdiagnosed with anxiety initially, and then months down the road, we get appropriate diagnoses. And that's when we are able to find doctors that are actually willing to go against the directive. Because like these physicians were discussing, their licenses have been threatened. And because their licenses have been threatened, we cannot get medical care. They are afraid to treat us. We have had patients who are severely injured and are dying who cannot get in the door to get seen by physicians because physicians are afraid of the word COVID vaccine. So instead, what they're doing is they've made us, like Kyle Warner and myself, and our membership of over 12,000 COVID vaccine injured, we are ground zero to take care of the COVID vaccine injured when we have highly qualified practitioners across the globe that have been silenced and threatened if they even so much as see us for what's going on.
There is the father of a boy here in this room who's died of myocarditis. 1 death is too many. One. We have 21,000 cases of myocarditis and climbing in the United States that the CDC has verified. 1 was too many. Under no circumstances, under any circumstances, should a young person ever receive one of these vaccines, let alone ever be pressured to receive a vaccine, let alone ever be mandated to take a vaccine. This is crystal clear. The FDA agrees. There can be no controversy over this. We are seeing unprecedented numbers of athletes dying on the field in Europe. Unprecedented. Of these cardiac arrests, half of them don't come back. We now have a report out of the Heart Group in the UK where actuarial mortality for those under age 15, mortality in the UK is higher than expected.
And I am concerned about our children. I'm concerned about all of those effects. Brain, heart, blood coagulation, reproductive system, immunologic system, and furthermore, they're not at risk for this virus. Why are we doing this? And mandating these vaccines for children just breaks my heart.
This is what we get when I investigate. I mean, this isn't to do with this, but this is after a couple of years trying to get information out of another agency, and we finally get the information, and it's all redacted. This is how the federal government, the agencies, comply with congressional oversight.
This dose that was tested in a major trial, which made corticosteroids the standard of care worldwide. And I also want to give praise to Senator Johnson. You know, Senator Johnson invited me to give testimony in the Senate in May of 2020. And I remember my first conversation with him when he reached out. And he was so enthusiastic about hearing about the work that Dr. Marek and myself were doing, that we were putting out protocols and we were trying to treat this disease. You know, and he said he couldn't understand why the system wasn't reacting, why the entire system wasn't reacting the way we were. And I remember he told me, he goes, you know, I want the doctors to take their gloves off. And they're not. They were sitting idly by the bedside. Institutions were paralyzed waiting for randomized controlled trials to be done. And then finally a randomized control. And at that time I testified to the world that corticosteroids were critical in the treatment of this disease. Nothing happened until a trial came out 8 weeks later and proved the life-saving properties of corticosteroids. But that dose that was tested was ridiculous. It was the lowest dose. And the dose that's being used helps the few and fails the many.
I want to personally thank you. In the past, medical schools and conferences like this would take place. We debate how to treat these kind of diseases. And, you know, it's kind of strange that this meeting has to take place in the U.S. Senate. You know, given the current state of affairs, that's where we are. But in the past, we would think that somehow the FDA, the CDC, the NIH, we would have basically maybe a message board, exchange ideas. And I really want to reach out and say thank you for what you've done to Dr. McCullough and Dr. Risch, who initially set all of this up. You know, the extreme censorships and attacks have led us to come to this place. And so I want to just thank you for what you've done. You've really pushed this all forward, you know, you've been yourself become a researcher and a scientist over this last 2 years, so thank you very much.
These are highly qualified individuals. They speak from experience. We've got to fix this problem. We can't let this continue. We can't let it happen in the future. So again, thank all of you for coming. Thank you for being doctors, for being nurses, for being academicians, for being medical researchers, and thank all of you for viewing this. Share this with your friends. God bless you all.